Hi, I'm Dr. Zachary Stockton. I'm a chiropractor, and I wanted to explain a little bit about the 3 phases of chiropractic care today. The first phase in the beginning is truly where I see most of my patients because they've come to see me because they have something that's wrong, and the warning signs that we see is generally pain. So most of my patients come to me when they're in pain, and the first phase, the first thing we can do to help them out is to get them out of that pain, or at least take the edge off so that they can start going through life again. So we call that first phase relief care. And generally speaking, it's very quick, a few days to a few weeks, depending on the severity and how long that condition has been there, but we can usually get patients feeling good pretty quickly. Now, if we just stop right there, that's sort of like taking the batteries out of your smoke alarm. Pain is an alarm. It's telling you something's wrong. It's the way your body and brain communicate. If we just address the symptoms, but didn't fix the underlying cause of those problems, it's reasonable to expect those problems to return. So if we get over relief care and we don't continue correction, you can coast for a while, but there's really only one way to coast, and that's downhill. It's a matter of time before you have a relapse. And this is why some people feel, oh, once you go to a chiropractor, you need to keep going back, or I feel bad, because they get on this yo-yo of addressing the symptoms and then leaving for a while, addressing the symptoms and then leaving for a while, and just coming back when I need it. That's something that I'm here to serve my patients, and if that's all they want is pain relief, I'm here to help them out. But I truly believe the real power in chiropractic is this second phase, which we call correction, strengthening, and rehabilitation. And that's where we address the underlying cause of the symptoms, not just the symptoms themselves. A real structural change takes time. Most of our patients come to us in this first phase after a long time of pain and suffering. We can't expect that to be fixed overnight. It can take months to even years to get that correction. Now, the second phase, I truly believe, is the most important. Now, the good news is, while we often need to be seen more frequently in the beginning, once you start to hold those adjustments and those real changes start to take place, we can usually start spacing those adjustments out a little bit more, spacing those treatments out a little bit more. Eventually, after however long it takes to get totally corrected, you're faced with a decision point. If you've invested this much time, this much energy, this much effort into getting a problem fixed, it only makes sense to me to move into the third phase, which is what we call maintenance or wellness. And that's where we make sure that you're staying up here at 100%. Just like you maintain your teeth or your car or your relationships, a spine to stay healthy and functioning at its peak potential also needs to be maintained.